my name's Jack Navein. I work in A&E in Addenbrooke's, and I also work pre-hospitally at Magpass Air Ambulance. I had quite a bit of ultrasound experience, but I'm heading towards finishing my training, so I should finish my training in a few months, and I just wanted to make sure that I had everything in order and that I wasn't leaving anything to chance, and that I had everything signed off and all nicely tied up before my ARCP in a couple of weeks. I mean, I've finished getting all my DOPS signing off, the ones that I needed. I'd done a few, but I needed a couple more, so that's all done. That's nice. And then having had a chat to George was really useful, because he's sort of told me exactly the few remaining things I need to do, and shown me a couple of ways to make sure that when it comes to the day of my ARCP, everything looks perfect. So that's been really invaluable as well. What was really nice is that, because it was a small group, they just asked, I think we've got very different needs and different experiences, but they made sure that they've tailored what we needed specifically to us. So George has spent quite a bit of time with me just making sure that everything I needed for my ARCP was done, and I think there's someone here that's right at the beginning of the ultrasound scanning, and they've taken him away and they're just essentially teaching him to ultrasound, so that was really nice. George is like the regional ultrasound lead for where I am, so that was amazing. That's like super convenient for me, and I didn't know who was going to be teaching the course, and again, for something that's sort of advertised as a sign-off thing, it's really good to have someone who is essentially an expert in that, but I wasn't necessarily expecting to have him here, so that was really good. More models than I was probably expecting, because it was a small group, and I really liked the ultrasound machines where the simulators for pathology, because that's really good, because you can scan lots and lots of people get normal things, but it's nice to be able to try and use the ultrasound to work out some diagnostics as well, so that was good. Yeah, I definitely recommend it. I think there's lots of ultrasound courses out there doing lots of different things, but I think this is the only one that does what I needed essentially, which was to get everything ready for finishing my training. And for that reason, I definitely recommend it. I know there isn't any other courses like that out there, because I had a look, and this is the only one that does kind of what I needed, which is great.